Good afternoon, good morning, good evening, whatever time you are watching this presentation. I hope that everything is going well while you're in quarantine. And just a little bit about myself. My name is Chandra Arble. I am an epidemiologist at Hamilton County Public Health Department. I went and I received a biology and dual chemistry degree in my undergrad, and then I went on and got my master's in public health epidemiology. And I've kind of taken a curvy road approach to what I want to do, but I can't tell you how much I love my job right now. So today we're going to talk about an epidemiological response to COVID-19. So this whole presentation, we're going to talk about, one, what is epidemiology? What is the daily work at a local health department? What does that look like? Then we're going to go into COVID-19. What is COVID-19? Responses to COVID-19? What are some of the effects of the body, COVID-19? And then lastly, we are going to talk about your role as social work in all of this. How does epidemiology and social work even fit together? So epidemiology. This picture actually is so funny to me because none of it is what I do. So a lot of people do believe when I say, oh, I'm an epidemiologist, they look to the bottom left picture and they think, oh, you work with the skin, right? Because epidermis, epidemiology, and like, no, that's not what I do. Epidemiologists all want to be like the middle bottom picture and be kind of, this is from a movie called Outbreak, and she is warning everyone of this huge pandemic that's going on. And so we kind of want to be that person. But in all reality, we work with surveillance data and we are looking at everything from a population level. So the definition from the CDC of what epidemiology is the study and distribution and determinants of health-related states or events in a specified population, and the applications of this study to control health problems. So we're looking at population health, and we're looking at how can we make our community, our county better, our state, our nation. And there's different levels of governing bodies as well in public health. So there's a vast number of careers that you could be a part of if you do choose to go pursue a career in epidemiology. You can work in local or state government, you can become a biostatistician, research coordinator, pharmacoepidemiologist. There's even social epidemiologists, which we will talk about in a little bit later. And then obviously for those people who love to be outdoors and in nature, we also have plant microepidemiologists and geneticists if you'd like that as well. So the career options are vast. I actually work on the side of injury surveillance data. So I collect information on the opioid epidemic, cancer data, and I also collect hospital injury data. And all of this happens on a daily basis, and we just always have a lot of data coming in to us, which it's nice to work at a bigger health department to have more work in a sense. So the public health system, we are far-reaching in the community. We not only serve like our population, but also those agencies within our population. And so we have connections with nursing homes, civic groups, neighborhood organizations, laboratories, faith-based institutions, even all the way up until like elected officials and doctors and hospitals, of course, as well. So part of what we do, this circle on the right-hand side, we look at assessment, policy development, and assurance for every health department. So we monitor health status to identify and solve community health problems. We diagnose and investigate health problems and health hazards in the community. We inform, we educate, and we empower people about health issues. We mobilize community partnerships and action to identify and solve health problems. We develop policies and plans that support individual and community health efforts. We also enforce laws and regulate to protect, obviously, the health and ensure safety of our community. We link people to needed professional and personal health services and assure the provision of health care when otherwise unavailable. We assure competent public and personal healthcare workforce. That's a big thing right now. We evaluate effectiveness and accessibility and quality of personal and population-based health services. We also are part of research for new insights and innovative solutions to health problems. So part of the local health government system, this is kind of a map of the United States and the different systems. So every state has their state health department, and then every county, or not every county, most counties have their own local health department as well. So Hamilton County, we actually have two, actually like three, because Cincinnati, Norwood, and Hamilton County are all separate entities. We have a decentralized structure at our state. And so our local health departments get to kind of make our own laws in a sense as well. And we don't have to necessarily have that top-down lawmaking that some other states might have. So it's kind of a good thing for us, and we've definitely utilized that. So part of my daily work is reports. We put out a lot of reports to disseminate information. Like, that is the main goal, is dissemination of information. We live in a time where data truly pushes and mobilizes so many things. And so giving that data in a readable form for people to understand is what we do. So we take all of the data, we clean it up in different programs such as SAS, statistical analysis software, or even R, which you might have heard of, which is a free software. And then we put it into reports that you see right here. So this is a daily injury report, actually, that we put out daily. We also give presentations to the community. And then we have meetings with organizations. I am part of the opioid fatality review. And with that committee, we present information quarterly to the group to see where are we missing things, where can we pull in different resources, or where can we put our next syringe services program van at. And then we also do public forums and focus groups just to see, like, what are the community needs as well. One of the cool things that I have gotten to see, and I wish that we could kind of copy, is Johns Hopkins. They have an amazing COVID mapping system right now. I'm going to see if maybe I can get over there so you can see it. Let's see. So this over here on the left-hand side is their mapping system, and it's really in-depth and cool if you ever have a chance to kind of check it out. So this is just their COVID mapping system right now. So they're using ArcGIS and Esri, and they're taking information and disseminating it out to people and kind of helping to understand what's going on right now. So as we transition into what is COVID-19, part of, like I said, my daily job is injury surveillance, but because we're in the midst of a pandemic, I get to participate and be a part of infectious disease at this time. So it's kind of a fun learning experience even for me. So coronavirus is a large family of viruses that can cause illness, and ranging from common cold to even more severe things such as MERS and SARS, which you've probably heard of already. These are all typically transmitted between animal and people. So these are zoonotic viruses. There are 4 common human coronaviruses that usually cause typically mild respiratory illnesses, and they're not the same as COVID-19. COVID-19 actually belongs to the coronavirus family. So coronavirus also has different names, as we've seen. We've heard SARS-CoV-2, coronavirus, or COVID-19, novel coronavirus. This infectious disease is caused by a new or novel coronavirus, which means it hasn't been seen before in humans. And so it was first detected in Wuhan, China, and it causes a lower respiratory illness. So how is it spread? It's spread between person to person, close contact with others, typically about 6 feet. Now we're kind of thinking 6 to 10 feet. It's spread through respiratory droplets that are infected when a person coughs or sneezes. So, we've learned from when we're little to cover your nose or cover your mouth when you cough. And this is vital at this time to do so. So people are thought to be most contagious when they are most symptomatic or the sickest. So as this virus has progressed, we have found out that people who don't have symptoms can spread the virus, but at this time, we still believe that people are most symptomatic when they are the most sick, or most contagious when they are the most sick. So that's still kind of a standard thing. So these are kind of some signs and symptoms, and not everybody is going to get the same thing, but part of epidemiology is that we develop case definitions. So we want to know, how do we determine someone is positive for COVID, is a probable case, or is negative for COVID? And so these are kind of like some of the things that we use to measure those 3 areas. And a positive COVID patient is someone who has been tested and the testing has come back positive. So that is our definition for a positive case. A probable case is anyone that has these symptoms and that has been in close contact with someone who is positive for COVID-19. So someone who, say, is in the close contact with someone who's positive, you might hear the word they need to quarantine or self-quarantine for 14 days. This 2 to 14 day period, this is called the incubation period. And this is the time when it's kind of a standard time frame for all like disease. So bacteria, viruses, kind of their time to grow and replicate in your body. And so we want to see within that time frame, do people get sick? Because if they do, then they could possibly have it. But if they don't, then that's a good indication they probably don't have it. So COVID's effect on the body. So right now, we are seeing that a lot of people are having acute respiratory distress syndrome, or SARS. So we heard of SARS earlier, and MERS. This is acute respiratory distress syndrome. And this just is a sudden like breathlessness or dizziness. They could have rapid heart rate or sweating. And the symptoms result in like collecting of fluid in the lungs and the alveoli sacs. And so this obviously produces cough and chest pain, which could be persistent. So we want to, some other effects on the body could be damage to the heart or liver, kidneys, brain, endocrine system, or even the blood system. And there's been a study where they've shown that COVID-19 actually decreases the amount of oxygen that the body actually gets. And so this could be a cyclical thing. And because this is novel and it's new, we don't know everything that's going on. So it'll be interesting to see what happens in the next few months. And because we've been having to be so reactive, doctors have not been able to necessarily look at those who have recovered so far and tested and seen like what's actually going on from those who recovered, because there's been so many cases every single day, as you've probably seen in the news. So who is at risk for COVID-19? Early in the outbreak, we assumed that only the elderly got it. Now we know that more people than just the elderly can get COVID-19. There's increasing instances of community spread in the United States. And so people who are going from a place that has a lot of COVID-19 in their community somewhere else, they're a possible carrier and risk. And then, of course, our healthcare workers and our first responders caring for patients with COVID are at elevated risk as well. So again, close contacts, infected people, travelers from affected areas, either internationally or even locally, healthcare workers, and first responders. People who have severe underlying chronic medical conditions. So we have noticed that a lot of people who have comorbidities have more serious cases of COVID-19 illness. And then, of course, people who are immunocompromised. This has always been the case for any disease. So how can you protect yourself? And this might seem a little like we're in preschool and you have to repeat everything, but this is a gold standard for anything as far as protection. So washing your hands often with soap and water for at least 20 seconds. And then, of course, if you're in a public place, make sure that you wash your hands after coughing or sneezing or blowing your nose. And if you do not have soap available, you can use hand sanitizer that has at least 60% alcohol. And then, of course, as always, avoid touching your nose, your eyes, your mouth, your face, everything in this general area. Just try to avoid touching. And I touch my face all the time, and I have to be very cognizant, especially when I go out in public, to not touch my face. So to clean and disinfect surfaces, just make sure that you are cleaning like all of the high surface areas. So doorknobs, light switches, countertops, sinks, and handles. And you want to disinfect these typically with bleach. You can use alcohol solutions of 70% or greater, or I'm sorry, 60% or greater. But of course, bleach is much better. If the surfaces are dirty, of course, clean them before disinfecting. And then just make sure that you, again, avoid touching things. So if you go to the grocery store and you get groceries, you want to make sure that when you come home that you put everything away, unwrap everything. You can even disinfect or clean the surfaces of things that you bought. Of course, for fruits and veggies, I always like to clean anyway before this happened with vinegar, but that's up to you. So as always, avoid close contact with people who are sick, practice social distancing, cover your nose, and seek medical care if you are sick. Again, when do you seek care? So if you, before COVID-19 occurred, if you would not have sought medical care for whatever illness you have, do not go now. Our hospitals and our doctors' offices are overwhelmed right now with the amount of patients that are coming in for COVID-19. So, but if you are ill and you do need to seek medical attention, go see your doctor first, and always, always call ahead before you go. And I have the Ohio Department of Health hotline on here, but I know for a fact that Kentucky also has a hotline that you can reach out to, and you can go to kentucky.gov, and it's right there on the top of their page, coronavirus information. So should I get tested for coronavirus? If you are sick, make sure that you reach out to your doctor first. It is not recommended that you get a COVID-19 test. They first recommend to get a respiratory viral panel before you actually receive a COVID test, because as you know, testing supplies are limited, and we want to make sure that we've kind of crossed off all the other possibilities before we check for COVID. So I like to just go over some general terms, just because sometimes people get confused at what each of these mean. So quarantine does not mean that the person has been tested positive for COVID-19. This just means that they've been in contact with someone and they do have a slightly greater risk than someone who has not come in contact with a person with COVID-19 to actually contract the disease. So they are asked to self-quarantine for 14 days. Again, that's the standard incubation period for disease. So isolation means that you are positive for the virus, that you have had a lab confirmed testing positive of COVID-19. And this is when, if you're in the hospital, you'll be placed in a negative airflow room, or you'll be forced to isolate at home once your symptoms have resolved for a period of time. And typically that time is 7 days until like all of your symptoms are gone. Because again, our standard right now is that you are most contagious when you are most symptomatic. And then again, pandemic is an epidemic that has gone across a large region. So this does not mean that it's associated with the severity of the disease. It just means region, like how far spreading has this gone? So I always like to put in this section, be prepared and not scared. So, a lot of, you've probably heard a lot of things going on right now about, what you should do, and a lot of fear mongering and even fake news, which we're accustomed to. So just keep calm and carry on. Have at least 2 weeks, or like even a month's worth of healthy foods. And just remember, just because you're quarantined doesn't mean you don't have to eat healthy. And then make sure if you're on any medications that you have a month's supply of medication. The FEMA actually has a really great resource. It's here on this slide at ready.gov, and it's a preparedness kit. And there's different variations of preparedness. So you can be prepared for storms or floods or pandemics, whatever the case may be. But they have some really great resources on there. And again, like there's no reason to be scared, but we want to be mindful, and we want to make sure that we are taking the right precautions in this time. So some responses to COVID-19, we want to just make sure that we discern and distinguish what we are listening to and what information we are actually seeing. So of course, I would not recommend getting your information from social media. And of course, don't be anxious or worried or obsessed even with what's going on. I like to check it maybe once a day and then go on about my day. Be in community. So this is a great opportunity right now. We live in a time that is perfect for, stay-at-home orders, because we can FaceTime, we can Zoom call, we can, there's so many different modes, Snapchat calls, there's so many different modes of communication now, which we can do. And so take advantage of that and make sure that you are still in community. And of course, this is a difficult time for all of us, everyone around the world. So never be prideful about talking to a counselor and seeking help. If you are feeling anxious or worried, or, it doesn't matter what the case may be, do not hesitate to seek help. Trauma can look differently for different people. And then during this time, it's kind of nice, especially since people aren't working and things like that, just to be able to serve others. So just whatever that might look like for you, whether it's delivering groceries for the elderly or medication, or I know like it's kind of fun. My friends make videos of them telling stories and doing like little animations with it and post it on Facebook, just even fun things like that. And so again, this is a great time to connect with people that you might not necessarily connect with regularly. So here's some other resources that you can look up in your spare time if you ever want to. And again, that Johns Hopkins map is a pretty cool resource. So what does this look like for social work and epi? How do these two, what seems vastly disrelated things, actually relate? So anytime there are disasters, anytime that there are pandemics or hurricanes, tornadoes, devastation of whatever type, there's always isolation. There's always children who are left feeling rootlessness. In fact, like their parents have passed away. I know that's a big thing for the opioid epidemic. There are so many children in our system because of that. There's grief counseling that's needed, people who need new placement in mental health and long-term care facilities because their facilities have been shut down. There are therapies needed. There needs access to clean water and medical treatment. There's so many needs that come out of disasters during times like these. So I love this quote. I found it in an article on Social Work Today, and it's from 2009, so it's a little bit old, but I still feel like it's very relevant. Social work has forgotten its roots. Social work originated and grew alongside public health in the early 20th century when social workers partnered with doctors to combat sexually transmitted diseases and other infectious diseases, and to improve maternal child health in settlement area houses. And this just shows like how we can work together in partnership and how we are both needed for times like this. So I know with my work in opioid fatality review, we work with Job and Family Services, and they have some amazing social workers on their team, but they actually have been able, because of the way they see things and the way we see things, we can come together and help to mitigate issues for children and families who have gone through losing a loved one from opioid abuse. And so, that's another thing, is that we can definitely partner in the future, and I look forward to partnerships. And earlier I mentioned that there are people who pursue a career in social epidemiology, and so maybe that's a career that you would like to take. So you'll have two different mindsets kind of coming together to mitigate one specific thing, and you'll have one specific goal, which is the health for all. So thank you again for listening in. And if you have any questions or comments or suggestions on how to make this presentation better, please feel free to email me at any time. And again, thank you very much, and good luck in your future endeavors.